Dynamic documentation workflows and viewpoints. I can navigate through the menu to the inpatient workflow page, and there's viewpoints in there for admission, manage, and discharge. The admission viewpoint is set up very much like the ambulatory viewpoint. The documents that are contained can be grouped into encounters, so you can see just the documents that are in this hospitalization versus the documents for previous visits. In manage viewpoint, you'll only have the documents for this hospitalization. So I opened up the consultation note from this patient's admission with a GI bleed yesterday. This is Dr. Guerra's note from the GI specialist. I find what I want as I'm reviewing, and I can highlight and tag that and go back to reviewing more of the information, looking at the vital signs from this hospitalization. I get to the problem list, and most of the problems have already been selected upon the patient's admission. Later, the patient's going to complain of a cough, you'll see, and so I'll add that to the problem list now. The patient's chronic diseases can be brought up to this visit diagnosis just by a simple click. There are many ways of entering subjective data into the chart. I'll first show how I use auto text. I've created my own personal auto text for this demonstration of inpatient base note, which will give me basically the information, the starter notes, such as entering in it's a 42-year-old patient and what hospital day they're in. Many patients, providers will prefer to enter this information in just by freehand typing or perhaps voice recognition, but I like to give myself a little bit of a background by giving some auto text templates to start typing in. The patient's problems are diabetes and melena. For the diabetes, that too, I have an auto text template that I can use just to get some basic information about the patient. Certainly people might want to have something more elaborate if they're an endocrinologist. The patient does not have any symptoms for the diabetes. You can see that then I can hit F3 after I've typed in more information and select, for instance, this patient has neuropathy, and I can easily click over to yes with this. The patient's current home regimen is not being used because they're NPO. So in these templates, you can highlight whatever selection you don't really want and just kind of type right over the top of it. So I'll add here the patient's NPO and that we're doing those glucometer checks every 4 hours. Go on and comment about the melena. As I type, you'll see there's a typo, and the nice thing about this dynamic documentation is it got spell check in it, so I could quickly fix any of my typographical errors, which are usually many. Additionally, we need to enter in the examination findings. Again, free texting or voice recognition are going to be very highly used. I like to use a template here that's just a basic template that I built that gives me the exam findings you'd find on any patient just by looking at them in the room, and then I fill in, for instance, on a GI bleed, I'll choose a high level of abdominal exam because I know I'm going to spend a lot of time with that. And this patient had an aortic murmur, so I can type in heart and then from the drop down find my aortic murmur template and change the components that are specific to this grade 3 systolic murmur that actually does not have any radiation to the carotids. Again, the auto text will work to fix any misspellings. And as I mentioned, there's no radiation, so I can change that. So we'll save everything. I just remembered that the patient did complain of a cough, so I want to go back and go up to the subjective, even if it's hours later. This is all just held on in a holding area. So I can quickly add information as I need throughout the day. Again, correcting for any sorts of typographical errors, and again, resaving. Now we are going to show how the tagging works with labs and radiology. Tagging, I think, works best for individual lab test results as opposed to lots of clicking with if you're saving or you wouldn't want to tag an entire panel of labs. X-rays again are kind of like tagging a note where you just grab the textual field, and I like to highlight all the way up to the name of the test, and then I will push the tag button. There is a button you can push to see what items you've previously tagged. Let's look at what happens after we push the Create Note button. This is a real important part because you need to make sure that you first, in the type, you need to make sure you get the information into the right folder. So we'll choose Progress Note Hospital. Under title, that's less important, but I like to put in something like Hospital Day 2. And then we choose the note template, which is, in this case, this soap note. Remember, I tagged that Melina information from the specialist, and so I'll drag that in. You'll see as I want to put in here that this is the GI consult's interpretation, so I'll add that in. And you see there's that little footnote in the bottom, the number 1, right next to there. And I'll highlight. I like to give extra emphasis that these aren't my words; these are where I read from someone else. So I'll highlight anything I drag in from someone else's note, and I'll actually italicize it. So let's go down, and you'll see that the labs that I tagged automatically go into the lab section. Now, I mentioned about using smart templates, and here's where you'd use like a CBC. We have the CBC short that doesn't have all the indices and all that, just the the basic fish note type of CBC results, and then BMP. I made my own one with just a little header so I can break up. You see it says chemistry is on the top of this. And then let's drag in the X-ray results into the diagnostic section. It has a lot of, you see that it took away the left column that had the tags information there because there's no tags left. And then I clean this up by just removing everything other than the date, the X-ray, and then the interpretation. We'll move on to adding in the assessment and plan results. And I can free text, voice recognition, or use templates. In this case, I'm mainly doing free text and some auto text templates. And there's the orders down below of anything I ordered here today. Now let's take a look at the end note.